arch construction lecture. Introduction. Full arch construction involves creating prosthetic restorations for either the upper, lower, or both arches of the mouth. The process varies depending on the materials used and the specific requirements of the patient's dental condition. Steps for full arch construction. 1. Determine the material of the prosthesis. Options include PFM, porcelain fused to metal, zirconia, and PEEK, polyether ether ketone. Each material has its unique properties and method for construction. 2. Identify regions to be restored. Upper arch only, lower arch only, upper and lower arches. Materials and methods. PFM, porcelain fused to metal, zirconia, PEEK, polyether ether ketone. Each material requires a specific construction method. Construction steps overview. The steps for construction will vary greatly depending on the material used and the number of arches to be restored. Treatment planning. Importance of treatment plan. Ensures implants are placed according to the plan for straightforward and cost-effective results. Deviations from the plan can lead to complications and increased costs. Key fabrication for try-in. 1. Create a key using rubber base. Mix the rubber base and place it on the facial surface, covering part of the incisal edge. Make 3 grooves on the model to set the key in place. Remove the try-in with the rubber base only on the model to guide the technician. Teeth restoration guidelines. 2. Teeth restoration, usually restored up to the first molar. The second molar is optional and should have opposing teeth. Abutment selection. 3. Select abutments using the abutment selection kit. Ensure there is 2 to 3 millimeter space for the restoration. If the abutment touches the key, select a shorter one. 4. Parallel implants. Use angled abutments to correct implant parallelism. Abutments should not touch the key. Metal framework. 5. Metal framework with denture teeth. Available in screw-retained restorations, not cement-retained. Allows for easy future adjustments. Types of full arch restorations. 6. Types: acrylic with metal, metal framework with denture teeth, PFM, PFZ, Z, zirconia, PEEK. Detailed steps for metal framework with acrylic resin and denture teeth. 1. Impression on implant level. 2. New jaw relation record block. 3. Fit the teeth and make try-in. 4. Fabricate the key. 5. Use abutment selection kit. 6. Ensure parallel implants. Handling implant angulation issues. Use special device to ensure parallelism. Measure angles and select appropriate abutments. Abutment screwing. Use torque wrench or electronic torque wrench. Taking impressions. Closed tray or open tray techniques. Splint impression copings using dual ligature or composite. Model preparation. Inject PVS material for soft tissue model. Create model with abutment analogs. Verification. Create verification jig or index. Ensure implants on the model match the patient's mouth. Gold or plastic abutments. Use temporary abutments. Splint with Duralay and test in the patient's mouth. Single screw test. Test full seating of verification jig. Adjust as necessary. Sending jaw relation to technician. Include all information. Metal framework fabrication. Replace plastic teeth with Duralay or wax. Ensure cantilever thickness at least 4 millimeters. Final steps. Remove Duralay or wax and cast metal. Try metal framework in patient's mouth. Remove flanges for easy cleaning. Hygiene considerations. Fitting surface. Made in metal for better hygiene. Function considerations. Group function versus canine guidance. PFM. Screw retains specific steps. Impression and model preparation. Use UCLA abutments for restoration. Spruing. Investing and casting. Key requirements. Lower arch only. No key required. Upper or both arches. Key is required. Conclusion. Full arch construction is a detailed process that requires meticulous planning and execution. By following these steps, dental professionals can ensure successful restoration with optimal function and aesthetics for the patient.